Good morning and welcome to Weekend Express with me, Brenda Zedoradido, here on KTN News Center. Always a pleasure having you tuned in this morning. Our focus is still on the COVID-19 that has claimed several lives. Italy being one of the countries that has been hit so hard by the COVID-19. Here in Kenya, yesterday Kenyans turned to God for prayers, for intervention. The service was led by 40 clergy from different interdenominational, churches, and also President Uhuru Kenyatta, his deputy William Ruto, and ODM leader Raila Odinga were among some of the political leaders in the country that were also present during that interdenominational prayer service that was held at State House. So far, 7 cases have been confirmed in the country. We're still waiting for more test results from the government just to tell us whether the numbers will go higher or remain at 7. But it is the prayer and hope of every Kenyan that that number will not go higher than what it is. This morning, as a lot is lined up for you, but first, I'd like us to have a look at the press review this morning. Different newspapers over here. I have the Standard newspaper and Nation newspaper. But I'll begin with the Standard newspaper. And, our focus still on page 1. Actually, the entire paper is about matters coronavirus, COVID-19. And scientists are racing against time just to try and find some cure. Several people are talking about chloroquine. Several people are talking about, different vaccines that are being worked on. And that is something that Kenyans, the world is keenly following just to know whether a cure will be gotten as soon as possible. Now, on page 1 of the Standard newspaper, it is Corona, the grim lessons. These are some serious lessons that Kenyans need to learn. Now, one of the lessons from the world that we need to learn is self-quarantine. But sadly, even as we speak about self-quarantine, people are not keeping that distance that the government has been talking about. The public's willingness to keep social distancing remains the best tool to curb transmission. So every Kenyan needs to keep that distance that the government has been talking about. And that's why, several Kenyans are having church online today, or either having, their own personal time with God, because several churches have decided, to close the doors of churches so that, people can self-quarantine. Now, the other thing is about the when we need to flatten the curve, the virus takes heavy toll on a country's healthcare system. Planning ahead is key. And that is why the government is calling upon several health officials just to ensure that they go back to work and attend to Kenyans who've been affected, and also they're also taking serious precautionary measures just to ensure that they're safe. The other thing is home care. For the less critical patients of corona, home care remains the best mode of intervention. Even as much as you're doing that self-quarantine, home care is how you self-quarantine is so important, so that you don't infect the people around you, your friends, your family, your children, your husband or your wife. Then the other thing is protecting protectors. That is the protocol towards the safety of doctors, nurses, who ought to agree on implemented before things get worse. Something that I've talked about earlier on. Then we have legislation, armed laws and executive orders needed to boost healthcare measures during the, pandemic period. And lastly, collaboration that comes into the private and public hospitals that need to work together in collaboration between agencies, which is crucial. And when we talk about the private and public hospitals, as much as you go for testing in a private hospital, once, your test results come out to be positive or you show symptoms of coronavirus, you'll be taken to Mbagathi Hospital. Once the test results come out and probably you're found to be positive, then you will be transferred to the Kenyatta National Hospital, where patients are there. Now, let's move to page, I'd like us to go to, let me actually finish with matter coronavirus before I move to any other thing. And, let's move to page 4 of the Standard newspaper, where we need to learn lessons from Italy. Italy is one of the countries that has reported high cases of deaths, surpassing, than for China, and also high cases of people who've turned to be positive when it comes to matters coronavirus. And there's several lessons that we need to learn from Italy. As we speak, right now, Italy is on a total lockdown, and that has affected its economy. Right now here in Kenya, coronavirus has also affected our economy, yet you're not on a total lockdown. And that is why, last week, the government was talking about, through the Ministry of Health, the Cabinet Secretary, Mutahi Kagwe, that next week is such a crucial week for the country because it will determine whether the numbers are going higher or whether the numbers will remain as it is at 7, even as the government tries to get cure for those who've been affected. And so that is why we need to learn lessons from Italy. Just avoiding, not washing your hands. You need to wash your hands. You need to sanitize your hands. You need to use a handkerchief when coughing. You just don't need to sneeze anyhow so that, droplets might get to someone else. But then, yesterday when I was reading the newspaper, especially the Standard newspaper, it was really sad that Kenyans are moving now from Nairobi to the rural areas with the aim of, saying that that place is safer than Nairobi. That is the same thing that happened in Italy. One of the states was put on a lockdown, and sadly people are moving from that state to another state, and that is how the spread of coronavirus went very fast, in Italy. And so it is our appeal that if you're in Nairobi, kindly remain in Nairobi. You never know. Probably you're going to the rural areas and you have coronavirus. Probably you're taking it to, our grandparents, our relatives or friends in the rural area. So it's very, very important that we avoid that lots of travel within the country. Now, away from coronavirus, after looking at the Standard newspaper, let's go to the Standard newspaper, page 2. It is about Uhuru's bloodless coup at City Hall that leaves Sonko idle. Remember, several, some core functions of the county, the county of Nairobi were taken by the national government. And so these functions that have been taken by the national government has caused a lot of uproar. Some saying that, the due process was not followed because it needed public participation. The input of the senators were needed. The input of members of the county assembly were needed. But for the Nairobi County Governor, Mike Mbuvi Sonko, he says that this will be for the benefit of Nairobians. And once, Major General Mohammed Abdallah Badi, took over the managing of some of the functions of Nairobi County, he said that he's expected to solve, some of the border and matatu menace and clear the garbage choking the city. Nairobi County has been one of the cities with a lot of garbage, and so that is why he said that within the next 100 days, Nairobi residents will begin seeing a bit of some difference, and so that is why even recently he went to Mudhurwa Market just to see how bad the situation is, so that they would start cleaning that city. However, relatively unknown until Sonko's tapped to the deal, Nairobi Metropolitan Services, that is NMS, the special purpose vehicle President Uhuru Kenyatta created to turn the county. Now, Badi is expected to cure the city's numerous challenges. So all eyes are on the national government as they take some of the key functions that have been taken, by the national government. Now, it is a sad day for country music lovers because, the mourning the death of Kenny Rogers, who passed on at the age of 81 from natural, illnesses. That is what his family said. And he died in the presence, he was surrounded by his friends and his family members. And, some of the people have termed him as a man who brought a lot of, peace using his music because of the country music. And I remember yesterday, our sister station, Katie and Home, was just having a time of remembering Kenny Rogers, with some of his well-known music. And, Dolly Parton was also, she was really affected because she's one of the female musicians who did some collabos with Kenny Rogers. And, if I may just read, what Dolly Parton said. He said that he was crying actually and gazing at a photo of her and Kenny Rogers. He said that her heart is broken and a big chunk of it has gone with him, today. That was yesterday. I was just reading the tweet that she had actually posted on her social media account. And, it is a matter of, just trying to come into terms. His death comes at a time also when the world is still grappling with the issue of coronavirus. So for the country music lovers, Kenny Rogers will be remembered as a man who actually brought some light, when it comes to entertainment. He will be remembered for songs like Islands in the Stream. And this is one of the songs that he did a collabo with Dolly Parton. Now, I'd like us to have a look at the last story, actually a last press review on Standard newspaper, before I cross over to the Sunday Nation. And let me the reason as to why I shelved this for the last, still on matter coronavirus, because I needed to, I said I was ending with it, but I need to end, review with the Standard newspaper. And I like what President Uhuru Kenyatta said yesterday at State House, that even science needs God. There's some people who were saying that this is not a time of prayer. It's a time of looking for a cure. But even as we look for cure, for cure for the coronavirus, the COVID-19, know, President Uhuru Kenyatta says that even science needs God. I totally agree with him. And that is why the country yesterday, you know, turned to God, you know, for divine intervention. And even after this, we saw several countries have actually called for a time of praying and fasting. We've seen Rwanda, we've seen Uganda, you know, saying that their time of praying and fasting will be today. And we've also seen countries like Nigeria are calling for a time of praying and fasting. These are just some of the African countries that are turning to God for a time of divine intervention. And you know, this divine intervention, time for prayer for the country and other countries that have been affected globally, was led by 40 clergy from different interdenominational churches. And you know, even as much as this, you know, when we saw the clergy and the leadership of this country gather together to pray for the nation, there are two important things that every person who was, you know, seeing this prayer service live, either from different TV stations, saw something really important, two important things. Our leaders kept that distance that the government has always been talking about, that a meter distance. And you can get even a copy of the Standard newspaper just to see, you know, the photo right there. And even as they walked into the premise, you know, of prayer, the premises of prayer, you could see President Uhuru Kenyatta hand sanitizing, showing that it's really important to hand sanitize your hands. But even as you do hand sanitizing, of importance is wash your hands thoroughly with clean water and soap. It doesn't make any sense for you just to hand sanitize your hands and then you end up not washing your hands. So hand sanitizer is really important only if you're in a place where you can't access clean water and soap. But let me just read for you what the president said. He actually faulted critics of prayer day as a religious leader, asking God for forgiveness and to deliver the nation, you know, from the deadly coronavirus. So even as much as our religious leaders were praying for Kenya, we also prayed for other countries that have been affected. We have Dubai, we have South Africa, we have Kenya, of course, we have our neighboring countries like Tanzania, Rwanda, we have Nigeria, we have the United States of America, we have UK, we even have, you know, Italy that has been affected so bad. We also have China, you know, that is still grappling with matters COVID-19, as much as the numbers have gone a bit, you know, down. And that's why they're also, you know, they gave us some testing kits for free so that the government can use to fasten, you know, the testing process. So that is why, you know, the president said that let us continue to pray for healing, understanding, and prosperity. Our God is a hearing God, and he will grant us our desires and wishes. Those were the words of President Uhuru Kenyatta, even as he hailed the media, you know, for playing its role in ensuring that the country, you know, Kenyans get that civic education. So it is my appeal to you, our viewers, that you stay at home so that we people in the media can continue, you know, giving you the latest updates as this, you know, COVID-19 continues to develop. And of course, even as the government say that every day, they'll be giving the country an update on where we are as a country. Now, away from the Standard newspaper, I'd like us to go to the Nation newspaper. The front page, and it still matters, you know, coronavirus, it has affected the economy. We're seeing job cuts. People are going to lose their jobs because of COVID-19. The economy is not doing well. But even before, you know, Kenya reported its first case in the country, we saw the economy was not doing well. But now with coronavirus in place, the economy has been affected so badly. Now, yesterday, we saw even the Kenya Airways CEO, you know, asking staff of the national carrier to take a pay cut, a 50% pay cut and unpaid leave. Some are supposed to take a 2 weeks unpaid leave, some 1 week unpaid leave, but they should also expect, you know, a salary cut. And you know, these pay cuts, which is looming for workers, you know, it also involved the civil servants in the country. They could be asked to take salary cuts should the pandemic persist. The other thing is money will be refunded once a virus has been brought under control. And that is something that, you know, KQCO talked about, you know, saying that once you agree, you know, to take a pay cut, the remaining amount of your salary will be paid, you know, once the COVID-19 comes to an end. And, you know, Kenya is also looking at options of probably just bringing the services to a halt until this a solution is found. You know, the government has also, you know, scrambled 140 billion shillings war chest to show up the economy and avert recession. We also saw the banking industry, you know, coming out to say that those people who owe, you know, banks some loan, they've also been given a reprieve of 1 year not to pay their loans because of COVID-19. So those are just some of the measures that the government has put in place. But still on page 1, you can see our leaders, you know, President Uhuru Kenyatta, Deputy President William Ruto, ODM leader Raila Odinga, Wiper leader leader Kalonzo Musyoka and NC party leader Musalia Mudavadi, just some of the political leaders who are in attendance, including some of the cabinet secretaries right there. And still on page 2, workers face salary cuts as farms, farms struggle to keep going. That is the same thing. We're still talking about matters, economy being affected. And we're just praying that the country will not go on a lockdown. It is a prayer of everyone that our numbers will not go higher than what we're experiencing. And that soon, a vaccine or in short medical treatment will be found. So many people are talking about different things that should be done, but let's wait for the scientists, even as much as we turn to God, for divine intervention, to see what they're going to come out with. And page 3 of the Nation newspaper talks about leading Kenyan scientists approached to join global search for coronavirus treatment. This week actually, can I say this week or last week, because we're beginning a new week? Let me say last week. We saw the World Health Organization saying that different scientists, from different parts of the world have come together, from different parts of the nation rather, have come together, to try and get a vaccine for the coronavirus. But right now, they have a vaccine that, WHO says that there is a vaccine on trial. And so far, 10 countries, including South Africa, have agreed to do that trial, and they're just appealing to other countries who'd want to do the trial to join other countries in terms of trying this virus and, the vaccine to try and get the virus out, to bring it to an end in short. And, a team of researchers from UON's Carvey Institute has been approached to lead trials in the country. I mean, we just hope that these trials that are being done will actually be a final solution to this. It is a prayer of everyone that these numbers will not go higher than what we have, not only in Kenya, but globally. And Kenyan scientists have joined, let me just repeat that, have joined the global race to find a vaccine for COVID-19. And the researchers in Kenya have been approached to identify candidates for the vaccine trials, putting the country at the forefront of high fight to stop the pandemic. And a research team from the University of Nairobi, that is UON, has already come up with a protocol for the research and have completed coronavirus case management guidelines, which have been handed to the Ministry of Health for publication. And still on page 3, Uhuru says country needs God's help as he leads National Prayer Day, what I reiterated earlier on, which was published in the Standard newspaper. Now, on page 4, coronavirus hijacks your body cells and lives off them. The reason as to why we need to do the 3 important things the government is talking about: wash your hands with clean water and soap thoroughly, use hand sanitizer in case you're in a place where you can't access water, and keep that distance that the government has been talking about. But sadly, as much as farms have decided to ask some of their staff to work from home, and the government also made a decision to close schools, we're seeing people flocking, pubs, drinking places. Yet the government is talking about self-isolation, whether you have it or not. This is not the time to take your children, to some mall to have some good time. This is not the time to invite your friends and relatives at home to have, some sort of celebration or run your own businesses. It is a time of self-isolation, and that is why, several companies have told their staff, work from home. It is not a time of, just going everywhere, traveling left, right, and center. If you're to fight this coronavirus, you have to do it as a team. We have to be cautious. This fight is not for the government alone. It is a fight that every Kenyan, you and I, have to take into consideration when it comes to the welfare of the other person. And someone once said, when you want to fight coronavirus, live as if you have it. Live as if the next person, seated next to you, standing next to you has it. Then that is the only way we'll be cautious. Because if I'm looking at the person seated next to me, I'll be like, probably the person seated next to me or standing next to me has it, then I'll keep that distance. Or, if someone wants to say hi to me and I'm like, okay, I think you have coronavirus, then I will not greet you. I'll either do an elbow, the feet, or I'll do this just to try and not to come into, to have body contact with you. And that is the reason as to why Kenyans are being asked to try and take some precautionary measures if indeed, the world has to win this war of coronavirus. And let me just have the last press review looking at Nation newspaper. Of course, page 5 is still about coronavirus, washing your hands and keeping safe. And then the last thing is about, the government banning all prison visits to curb the virus. And it's a total lockdown. It might prove hard nut to crack. It is not only, the prisons, being affected in terms of visiting, but also hospitals, private and public hospitals. The government is urging, you know, the management of these hospitals to ensure that people who are coming to visit the sick are only relatives of the people who have been admitted in hospitals. Friends, just stay at home, you know, for the sake of the people in hospital. Let's not take this sickness to the hospitals. Let's also be our brother's keeper. And as I finish the press review, it is my humble appeal that all of us, this is not the time to walk into a pub at night and drink yourself out until morning. When I was coming to work in the morning along Mombasa Road, I could see vehicles parked outside, you know, at a pub. And I'm wondering, are Kenyans really serious? Are we really, really serious? Wash your hands, keep that distance, stay at home, and also use hand sanitizer where in case you can't get, you know, access to clean water and soap. So it's the end of a press review. Allow me to take a short break. I'll be right back with more.